AIDS is a disease caused by the HIV virus. It's called the immunodeficiency virus. It was first discovered in primates and it was then transmitted to humans. The virus, usual means of transmission is sexual transmission, but it can also be transmitted by sharing syringes in patients who abuse certain IV drugs, or even it can be also transmitted when there are blood products that are used in the hospital that are contaminated with HIV. Sexual contact, and it's still like 90% of the transmission nowadays. AIDS is it's a disease which has a wide range of clinical a wide clinical range of presentation. It can range from an asymptomatic patient. Usually the first signs are a flu-like symptom, which is very inspecific, maybe some fever, some chills, and it can usually progress to something much worse. Usually the problem presents when patients are infected with another opportunistic disease, which can be anything from the flu to some rare diseases, which for example could be tuberculosis. It could be several for example yeasts and fungi, several bacteria and several viruses that are very specific to HIV patients. So the disease could usually depends on how it affects the patient's lifestyle. Usually when patients are asymptomatic and they know they have the disease, they will, their biggest limitations is in their sexual activity with their partners. They will usually avoid contact or take extra means when they, with their extra protection with their partner when they know they have the disease. But it can progress to the patient being in bed. He or she can't get up. She or he will have problems, eventually with even getting around. So it's a wide range of clinical, presentation. The same is for the prognosis of the disease. It can vary a lot mainly when it's detected. If it's detected and the patient hasn't manifested any other symptoms or any other diseases associated with the HIV virus, patients can live up to 20 years with current drugs and current treatment. That's about the lifespan of a person with HIV once they're detected. But if the patient didn't know he had the disease and now has several infections or other diseases associated with HIV, prognosis can be very poor. It can be around, it can be, even weeks, depending on the infection that's associated with HIV. The chief complaint that patients with HIV present also depends on the severity of the illness. Sometimes patients will present asymptomatic. It'll be detected by, with a clinical test. The patients, for example, who are asked by their jobs to take the test, or patients who know they have a contact with HIV, they'll go and get the test and then they'll test positive for it. Maybe asymptomatic. Other patients might present within the first 2 or 3 weeks of their infection when the symptoms, or the flu-like symptoms present, or they most commonly it will be detected when another disease is present, another infection is present. It can range from symptoms of pneumonia, which is most common clinical presentation. They can also present with symptoms of infection in their brain or meninges, which is the layer that covers the brain, or it could present with diarrhea or other gastrointestinal symptoms. It can also present with skin lesions, or also less commonly as lymphoma or other life-threatening infections. Okay. HIV can be detected by a test called ELISA, which is a rapid detection test. The patient must take at least 2 times the exam, take the exam at least 2 times to suspect, so that we can suspect that the patient has the disease. After these 2 tests, they have to take another confirmatory test, which is a test called the Western blot, which confirms the diagnosis. It could be further studied with DNA testing of the virus, and to get a better idea of what type of virus it is. But at least you need the 2 ELISA tests and the confirmatory test, which is called a Western blot. The treatment is based on something called highly active antiretroviral therapy, which is abbreviated HARRT. It consists of at least 3 different drugs with 3 different mechanisms of action acting on the HIV virus. That is the base of therapy, and usually you also need to take prophylaxis for other opportunistic infections that present with HIV. Patients which present with an opportunistic infection and weren't taking any antiretroviral therapy will usually only receive treatment for the infection they have right now, and the antiretroviral therapy will be initiated later on, and depending on the infection which they presented, the course will vary on how long they will take. They will start the antiretroviral therapy. Okay. If the patient doesn't receive any treatment for HIV or the opportunistic infections that present along with it, the patient will have a very rapidly deteriorating course. They usually won't last more than 2 weeks. Usually patients will first, like I said, will receive treatment for the opportunistic infection which they presented with, and then they will usually start the antiretroviral therapy. Okay. Prevention is really hard. It basically been the same for 20-30 years which we've had the virus. The main form of prevention for sexual contact is still the condom. There's not much new technologies in that regard. Healthcare workers which have been exposed to the virus can usually take at least one type of drug that's been proven to help prevent the disease, but it's been the same drug for about 20 years. Regarding treatment options, there's not much treatment or extra treatment that has been developed. It's basically centered around the replication of the virus to stop it from replicating inside our blood cells. It will usually usually the new therapies are simply directed against new forms of treatment that haven't been used previously. And there are some reports on the literature that some people have been cured with stem cell transplants, but that still hasn't been proven yet, so it's not likely that's gonna happen. And diagnosing in regards with diagnosing the disease, there hasn't been too much advances either. It's been usually, like I said, ELISA, which just has become faster, and Western blot, which has also become faster, but that's basically it.